Support provided in part by Louisiana Health Care Review, helping healthcare providers lower cost and improve quality for over 20 years. Information about healthcare improvement in Louisiana is available at www.lhcr.org. Support for this program is provided by the men and women of the Louisiana Forestry Association. Through sustainable forestry, LFA members promote the health and productivity of Louisiana's forests for generations to come. And the Foundation for Excellence in Louisiana Public Broadcasting.
Good evening and welcome to Louisiana Public Square. I'm Beth Courtney.
And I'm Craig Freeman. Healthcare reform was one of the main issues that Barack Obama promised to address during his term as president. He recently told members of Congress to act now to reform insurance practices and combat rising healthcare costs, or more Americans will lose their coverage and face bankruptcy. In Louisiana alone, the average family premiums have increased by 91% since 2000.
Well, there are numerous health care reform measures being discussed in Congress. Although everyone agrees reform is needed, at what cost? And what is the proper balance of private and government involvement? Tonight, we give Louisiana citizens an opportunity to voice their opinions and concerns about current proposals. We will also give our panel the chance to clarify misconceptions, dispel myths, and explore the Louisiana perspective on national health care reform. Ask anyone across the state about the ongoing debate over health care reform, and you'll find there's no shortage of opinions.
I am in favor of public option of the health care.
We do not need a government-run program.
I think we're trying to do too much at one time, and we haven't had enough time to really look at the bill.
I think that they need to go ahead on and do what Obama say. They need to go ahead on and vote on it. I really do.
In Louisiana, over $22 billion is spent on health care costs, according to data from the Center for Medicare Services, and roughly 20% of our population is uninsured. All the more reason why Louisiana has a great interest in this national debate. The issue before Congress is how to expand health care coverage while controlling rising costs. The common ground between both Democrats and Republicans is that insurance companies should not be allowed to deny coverage due to pre-existing conditions, charge higher rates due to health status, or place caps on the amount of insurance benefits. But as the saying goes, the devil is in the details, and when it comes to the details, Democrats and Republicans are sharply divided. Members of Louisiana's congressional delegation spent their August recess holding town hall meetings to hear from their constituents.
I have my eyes not on the president or Congress. I have my eyes on the people of Louisiana and the people of our nation.
Senator Mary Landrieu is one of only 2 Democrats in the Congress from the state and is considered a critical vote in the Senate on this issue.
I have from the beginning not generally supported a public option, but I want to keep this debate moving forward because I do believe, while there's no one perfect plan out there, that what I know is that the plan we have, whether you're on Medicare, Medicaid, or self-insured, is very expensive to you, your business, and to the government.
Representative John Fleming, a Republican from Shreveport, is also a physician.
The main burr in the saddle, so to speak, is this so-called government-run option, which really we view as a Trojan horse way of creating a single-payer healthcare system, such as what you see in Canada and the United Kingdom. And if you look at those systems, they don't work very well.
Still, Representative Bill Cassidy of Baton Rouge says when you get right down to it, with millions of Americans unable to afford health insurance, more than 540,000 of whom live in Louisiana, both Republicans and Democrats agree something must be done to reform the system.
Absolutely, and one of the frustrating things, I've been there for 8 months. Unfortunately, in Washington, sometimes politics trumps policy. there's low-hanging fruit that both sides could agree on that we could come together and have bipartisan support for.
Bills being considered by both chambers would expand the Medicaid program. That could mean coverage for nearly 750,000 more Louisiana residents, but with no guarantee that the federal government will pay for the program beyond the first few years. The governor is concerned that the state will have to pick up the tab. Under the Senate's proposal, a reduction in Medicaid funding to hospitals that see uninsured patients could cause the state's charity hospitals to downsize or close. And while House and Senate requirements for all citizens to carry insurance may spread costs and create savings, it will also increase the demand for primary care doctors. That's extremely significant in Louisiana, which already faces primary provider shortages. Julie Cherry is with the AFL-CIO, which strongly favors health care reform.
We think that having a healthier society is a good thing, and that in order to be able to have a healthier society, we've got to increase the access and affordability of health care.
Dan Juneau is the president of the Louisiana Association of Business and Industry.
I think our biggest concern has to do with cost. This is going to be a very large program. It's going to be a very expensive program, and we have some real concerns about where that's going to take us with the soaring deficits that we have right now.
Small businesses make up 73% of Louisiana's businesses, but according to the Agency for Healthcare Research and Quality, less than half of them offered health insurance to their employees in 2006. The House bill currently under consideration requires employers to either pay their employees health care benefits or pay a tax penalty. Cherry says while there will be some increased cost to employers, there will be substantial benefits as well.
When you look at the increased cost to those businesses that provide health care for, say, certain testing that doctors and medical societies recommend but maybe the insurance doesn't cover, it usually amounts to pennies per employee per day. If you're a large employer, that probably does add up, but if you catch something on the front side when treatment has better outcomes and lower costs, we're all going to be better off.
Juneau disagrees.
Current employers right now in Louisiana, and we fight this battle at the state legislature all the time, have seen coverage mandates put on them year after year after year. These generally aren't large increases in the cost of providing health insurance. They're just, scores and scores of smaller cost increases in having to provide health insurance. But if you have that policy for your employees, when those mandates come down, you have to pay for it. You don't have the choice of designing a health care plan and a health care policy that you can afford and that your employees can afford.
The president says the overwhelming majority of small businesses would be exempt from the coverage requirements. The Senate bill does not mandate employer coverage, but includes new business fees. Another thing missing from the recently released Senate reform bill is a publicly sponsored insurance option, which President Barack Obama supports. The public option would be available to individuals and small businesses and would be administered by the government similar to Medicaid and Medicare. But it would rely on the premiums it collects to be self-sufficient. The Senate version calls for co-ops that would be member-run insurance companies, similar to electrical co-ops, and would be available to individuals in one or more states. As Congress takes up the debate on health care reform in the coming weeks, many in Louisiana will be monitoring its progress, hoping for a healthier outcome.
Some of those people monitoring the discussion are with me in the studio. They include individuals who are randomly recruited and surveyed by LSU's Public Policy Research Lab and members of the Legislative Youth Advisory Council. Of those who responded to our pre-show survey, 51% identified themselves as Democrat, 22% as Republican, and 24% as independent or other. The majority of those surveyed, 77%, feel it is either quite or extremely important to give people a choice of both a public and private plan for health insurance. 6% feel it is not that important, and 15% rate this option as not at all important. To help pay for health care reform, 57% of respondents favor increasing taxes on Americans with high incomes. 34% oppose this approach. And as far as whether people should have a right to health care services, regardless of their ability to pay, nearly 3/4, 74%, agree they should, while 20% disagree. So let's start there. Is health care a right or is it a privilege? If I can't afford to pay for health care, should the government pay for it for me? Gary, what do you think?
Well, I don't believe that the government should pay for it for you, but obviously there are different people with different means, and some are able to provide it themselves, either through their work, but those that can't, we do have options right now that do cover people that don't have the means.
Helen?
It's not anywhere in the Constitution that we should be able to have health care as a part of being an American. So I think perhaps what should happen is we wouldn't get it from like the federal government, but maybe through the state.
Through the state. So the state should do this. Tasha, when we talked about the public plan earlier, it looked like you were in favor of that. Is this a right that we should all at least have this public option, or you don't think so as much?
Well, my concern is really how do we pay for it? I see that in some literature that we speak about, where they speak about expanding the Medicaid coverage, which could benefit those individuals who are low insured or low income. I do favor that, because we do have a right to protect those individuals who do not have the means to take care for themselves for various reasons.
Shirley, you were nodding your head. You agree?
I do agree. And I think what's dividing us on this issue mostly is how we're going to pay for all of this. Because basically, if one part of our community is unhealthy, our entire community is unhealthy. So we have to find some way that those people who are not able to secure their own coverage, that they get a level of health care.
I saw a lot of nods when Shirley said that. So do you all agree that everybody should get some care if we can afford it? Diane?
Oh, absolutely. As a registered nurse, I have seen the damages of what the insurance industry has done by denying care to people. And I believe that it's not just health care reform, it should be insurance reform.
Yes.
And this allowing them to deny people care by choosing who they want to insure should not be allowed. I saw some of the head CEOs of the main corporate insurance companies testify in front of Congress stating that they plan to continue to deny people care on pre-existing conditions. And as long as this continues, there's not insurance for anybody. We can all be denied at the whim of the insurance company.
Catherine, I saw you're agreeing. You have some concerns about pre-existing conditions?
Well, I basically quit my job as a lawyer to manage my son's medical care, which I think is absolutely ridiculous that I can't be a contributing member, a paid member of society, paying taxes and all of that, because it's a disaster to try, and if something gets miscoded, then that's me on the phone for hours and hours trying to get it recoded, refiled. My insurance company will automatically, deny the second, based on the computer, will deny the second, hit for the claim, and then I have to call and cry, and there's definitely, it needs to be improved.
I'm glad she spoke, because everybody tends to think that it's the uneducated, the low income, and here's a professional who had to give up a job to manage for her child. So when you look at this, it's not necessarily who we think it is. We need to look at this more globally.
But you guys seem to be saying that it's an insurance issue, not necessarily a government issue, but a lot of the coverage that I see in the media seems to be concerned about the government kind of taking over healthcare. Is this an insurance issue, Laura, or is this a government issue?
It's both.
How do we fix it?
We enforce the laws that are already on the books. Insurance companies sign a contract with ourselves. We are going to give you this amount of coverage for this amount of money. Do it. How many times have we heard since Katrina, since anything, that we have insurance companies that do not step up to the plate and do not honor the commitment that they take? They're willing to take our money, but they're not willing to pay it back to us. That's the problem that I have. Another thing, too, along that same line. What about all of us that do pay our insurance, because I know how much money comes out of my husband's paycheck every month to pay for the insurance. We've gone 4 and 5 years to where we've never needed to use it. Where did that money go? It sure didn't come back to us.
You were nodding your head. You agree? We need to enforce laws against insurance companies?
I think so. Insurance companies have really been the brute of what's going on, and that's why I'm one of the people who support a public option, because this allows for competition. The reason is they don't compete. When you can look at the state of Alabama, they're controlled by 92% of the same insurance company, which means they're entitled to do absolutely nothing but raise their costs and charge people a lot. So I think having an option there will allow for competitiveness and actually make these companies affordable for what they're doing to people.
LC?
Yes, I have to say that insurance companies, they are some of the most profitable organizations in the world. And as we all said tonight, they love to take your premium, but when it's time to pay, if you don't know, you're not aware, not knowledgeable, you lose.
Well, part of this enforcing laws means lawyers get involved. But I thought a part of this medical reform was that we wanted some tort reform for lawyers. Do you think that lawyers should be able to sue insurance companies if they're not paying, or doctors if they are doing something wrong? Or should we have some limits on that so that we can keep costs down? Harriet?
Why should we have to have a lawyer do our work for us? I mean, why can't it be a simplified thing where everybody can just take care of themselves? I mean, we need to have a rein on all this. It's gotten out of control.
George?
If I can go back to the insurance, I think there's a misconception about what insurance companies do and do not pay out and their profitability. Whereas premiums have risen 90% or so, profits aren't rising. Costs are rising. Insurance industry is on the low end, and so are hospitals on the low end as industries are ranked, I think somewhere between 77 and 86, something like that. And so I don't think insurance companies are getting away with ungodly profits.
So maybe they're not to blame. Barry?
Well, he is correct. The average insurance company only made roughly 3.3% in profit last year, and yet everybody's talking about the public option, but as far as I'm aware of, I can't think of a single thing that the government has actually run that actually works. I mean, you've got Medicare that's going bankrupt, you've got Medicaid that's bankrupting the states, and now you want a pattern of program based after the first two and expect me to think that it's actually going to work? I have a real problem with that.
I'm not in favor of the government running the insurance or the medical part of anything. I don't think they should be included in any decisions that are made for our medical history or anything else. It should be between the doctor and the patient. And as far as insurance goes, if you want your insurance, you know what insurance you want. You pay for that insurance. If you can't pay for it, I think there should be something to help you pay for it, but not completely do it. You pay for it according to how you can afford it. And if the government wants to help with that, fine. But I really don't see where they need to take over the whole thing and reform the whole unit.
I think when we look at a government option, it's important to note that a lot of people are getting distracted about the public option. Is there a way that we can involve the government in trying to work with the market to make insurance cheaper? I have a 2-year-old sister that was just diagnosed with a heart murmur, and we're looking at all kinds of different options. It's been complicated by the insurance industry. So can the government work with the market to make the process a little bit easier on consumers?
One of the concerns, I guess, is portability, and so would you rather a plan that allowed you to carry insurance, say, from one employer to another? Is that, Stephen?
Oh, absolutely. You want to be able to do that because when you leave one for whatever reason, you want to be able to pick it up immediately with your next employer, or even if you create your own company and start that. Some of the problems that the providers have, if you have a patient in front of you, if you have 3 patients in front of you who have a cancer diagnosis, depending on what their insurance is, determines whether they get this regimen of care, this regimen of care, or this one, or where they even provide the care. It may be provided in the hospital, maybe in the office, or maybe someplace else. This is not medicine. I agree with whoever said just a moment ago, go back to the physician-patient relationship and take that insurance piece out of it.
Millie?
I'm in favor of the doctor deciding how I'm going to be treated and what needs to be done, and I want the dialogue to be between us and not a third party or somebody out there. And I feel like there's a matter of trust in faith, is Congress going to really do the right thing for all of us?
Brenda?
Well, two things. I had private insurance several years ago, and one thing I found aggravating was it was hard to understand the EOB explanation of benefits, and I'd call, like, say, on a Monday, and one clerk would tell me one thing, then I'd call Thursday, and they would tell me something different. And that's frustrating because you should be able to understand it. And like one chiropractor told me one time, they code it so you can't understand it. And then the other thing I heard was be able to buy insurance from another state. Like if it's cheaper in California or Texas, I think the federal government, I've heard, is the one that's put that rule in place. If we could buy it from other states.
Across state lines. Matt?
I guess my concern is similar. We talk about, well, the government can't run anything. Well, can our private sector run anything right now when it comes to health care, when it comes to our outcomes, when it comes to our insurance? How many people in this room can read their EOB? Not me. You know, and some of you might be lucky, and some of you might have had great experiences. I'm sad because I think we're spending too much money, and we're not, as a society, we're already spending money. So if we're concerned about spending more money, well, we need to think about, if you look back 10 years ago, what it cost per family, per premiums, and then if you look at what it costs now, and are we healthier for it? No. And so it's not a question of government, it's not a question of private sector, it's not a question of are we scared of Congress, it's a question of all of us working together to have better outcomes, whether it be for my late wife who died at a hospital who didn't have to, or whether it be for the kind woman in the back who had to leave her job to battle all this. We can do better than this as a country. And I say it's time to work together, and it's time, like Representative Cathy said, there's the low-hanging fruit. Let's do that first. Let's get this right.
Well, let's work together and find some answers. And so when we return, we'll be joined by a panel of experts to further discuss healthcare reform and the Louisiana perspective. Welcome back to Louisiana Public Square. We're discussing healthcare reform, Louisiana's perspective. Joining us now is our panel of experts. Alan Levine is Secretary of the Louisiana Department of Health and Hospitals, the largest state agency. Prior to his appointment to DHH in January of 2008, Mr. Levine served as president of Florida's Broward Health, one of the largest public healthcare systems in the United States. Donna Fraiche is a healthcare policy analyst. She is a former member of the Louisiana Recovery Authority and was the LRA delegate to the Louisiana Health Care Redesign Collaborative. Ms. Fraiche is chair of the Louisiana Health Care Commission, but the views she will be expressing here are hers alone and not those of the Commission. David Sloane is Senior Vice President of Government Relations and Advocacy for the AARP. A member of AARP's national staff, Mr. Sloane is responsible for federal, state, and state government relations, as well as the association's grassroots, e-advocacy, and voter education programs. Dr. Stewart Gordon is an Associate Professor of Clinical Pediatrics and Chief of Pediatrics at the LSU Health Sciences Center, Earl K. Long Medical Center in Baton Rouge. He is currently the President of the Louisiana Chapter of the American Academy of Pediatrics and Chairman of the Louisiana Obesity Council. Dr. Gordon's views do not represent LSU. But before we go to our participants, I wanted to ask all of our panelists, are there any things that we can agree on that can help move healthcare forward for Louisiana and for the nation? Dr. Gordon?
In terms of healthcare reform, we need to look at this whole issue through the eyes of the patient. The whole reason healthcare exists is so that patients can get quality, cost-effective care in a HIPAA-protected environment, and good, sound decisions can be made for those patients by their physician and within that patient's medical home. I think the medical home concept is something I hope we all agree on. That was a term coined by pediatricians many years ago in the hopes that we would create this environment that provided access, comprehensive care, continuity, family-centered, comprehensive, with collaboration, and in a competent, obviously, setting to sort of put all that you could around that patient.
About that patient? Dave?
Yeah, I think there's a couple of important things. One, I think we recognize that cost is a major, major problem with health care, and it doesn't exist just in the federal programs like Medicare and Medicaid. The system is unsustainable from businesses, to families, to the government. We just can't keep up with trying to cover those costs. I think there is an agreement that in general we need to try to cover as many people as we can for a host of reasons, one of which is that, you know, it'll stop the cost shifting. When you have people who show up in emergency rooms, we're all paying for that now. There is no free lunch on that. So that's an important thing, I think. We also have to try to harness, to the extent we possibly can, market forces to try to move this forward. We're not talking about government takeover of health care. What we're really talking about in trying to cover the uninsured is to let insurance companies bid for this business through a product that looks much like what is offered to members of Congress in what's called the Federal Employee Health Benefits Program, where they have 6, 8, 10, 15 different health plans they can choose from depending on what their needs are each year during open season. So, and the other thing I think we really have to do is we have to refocus medicine from the standpoint of trying to move away from reimbursement based on volume and things like that and moving more toward prevention and wellness and trying to keep people healthy as opposed to treating sick care. That's one of the fundamental problems I think it really needs to change.
Well, I think that's a great segue. Paying for good outcomes, having affordable and accountable health care. And I heard so very much from the rest of the panelists before we came here and from all of you. I think our audience was just amazing. You had so many different backgrounds that were represented, and yet many of you shared the same concerns, that you really didn't want to go bankrupt if you got sick, and you didn't want to lose your coverage. You wanted to be able to maintain your coverage. You wanted to be able to move from job to job without losing your coverage. So insurance reform, I heard a lot about. And I think that's a common theme, whether it's through mandating an individual or mandating a company to have health insurance. One of the things I think is very interesting in the latest iterations in Congress, in the Baucus bill, is that there are some ways to incentivize small businesses to afford health care coverage by trying to make it much more feasible for them. And I think we're beginning to come around to this debate is not as violent a debate as we heard, that the sides are becoming much closer together because those things that are really important to us as Americans, basic health care coverage, affordable, quality, a lot of those basic principles are in the latest iteration in Congress now.
You know, I think there's a lot of constituencies here. I see Landon and Devontae, these young people here, and I think about the fact that in 2008, we spent $2.4 trillion on health care, and in 2016, they're projecting more than $4 trillion, and that's before we even have this discussion about reform. And if the debate is about we got to cover this 49 million people, something less than that are the real numbers, but somewhere in that range, we all understand, I think particularly the physician up here, and I would agree, that just giving people an insurance card doesn't necessarily mean they have access. You know, in the next 20 years, the number of Americans over 55 is going to double. And we have a shortage of physicians, of more than 125,000 physicians. And so regardless of who the president is, the law of supply and demand doesn't go away. When you have the aging population that's a heavy utilizer of services, and you have a shortage of physicians, you've created a cost driver. So we've got to address the fundamental cost drivers in this system. And I do think providing coverage is good and essential, but that's not the root of our problem. The root of our problem is here in Louisiana, we have 1.2 million people in our Medicaid program, our government-run health insurance program for the poor, 700,000 children. And yet our outcomes are not very good. We have the 50th worst overall health rankings in the country. And so I don't necessarily think giving somebody an insurance card and declaring victory is the solution. I think we've got to address the cost drivers. We've got to address the ability to get to a physician. And I think that we have to take some of the toxicity out of this debate and agree, as I think you said earlier, find those things we agree on and let's not do an overreach. Let's address those things we can agree on and let's come back and have the debate about those other things later.
And Catherine, I know you had some questions. We'll go to a group now for questions. Some questions specifically about children and how we help.
I feel like what I've seen, Kaiser Family Foundation and those things, what I've seen makes me feel like we're creating a gap for sick kids who have private insurance. If you tax my husband's employer, if you tax our health insurance benefits, that's going to hurt us because we're just we're squeaking by. We get no resources through the public programs. So it's all us, and if you tax us, that's going to hurt us. And then if you create an incentive for his employer to opt out and go for a penalty, where do you leave us? You're leaving my son with nothing because we don't qualify for a government program. But if you take all that away from us, we very well might. And you create all sorts of, I think, terrifying incentives for us to try and take care of our son.
Catherine, I think you're right. When you talk about the needs of families and children, and I heard the discussion earlier about whether health care is a right or not. I think health care is a right, but it's also a responsibility. I mean, 35% of our young people are either obese or overweight in our state. 25 years ago, type 2 diabetes in children was less than 5%. Now more than half the cases of type 2 diabetes is in children. These kids are going to be 20 years from now having cardiovascular disease, peripheral vascular disease, and cardiovascular problems. And I think there is a responsibility that comes as well with the right. I think, Catherine, that you have given more than your fair share of responsibility when you talk about leaving your job and to take care of your children, or your child. And I would tell you that too many families have to do that. In our Medicaid program, actually, the system that we run here, there's people that actually have talked about having to get divorced so that they can get qualified for Medicaid. So, that is not a system that any of us would be proud of. I think we want something better, and I think there's a lot of work to be done to get to that place.
And I think, Catherine, Catherine talks about children, but I think it's a concern that many have expressed, that you get squeezed in the middle, that some people will get coverage from the state and some get it from their employer, but if there are changes in the system, that there are some people that are going to get squeezed. What does reform mean for those people in the middle? Donna or David, Ed or Al?
Well, in Louisiana, the people in the middle are the people that are working very, very hard, but whose employers either do not provide or cannot afford to provide coverage for them. So there's a disincentive to work. If you're poor, you have coverage. If you're very sick or you're acutely ill, you go into the most expensive form of coverage, which is in the emergency room. And then after that, there's very little aftercare that you get. If you're elderly, you have Medicare, which is a public option program, and it's a public mandate program over 65. What I think is critical to any system is to make sure that the responsibility that we're talking about applies to everybody so that the risk can be well spread. And a number of you talked about why the risk should be spread so that Catherine, that has a really serious situation, can afford to have her situation taken care of. We are a very generous and giving and loving society in America, but you wouldn't know it from our health care. You wouldn't know it from what we're able to provide and share for each other. So everybody needs to step up to the plate and pay something. There should be no free ride. And I don't believe that the policies that I've been able to study and look at, the substantive policies, have a free ride. Everybody's going to pay according to their ability to pay, so that the people that are well and young will also be part of the system to spread the risk for those that are less fortunate and catastrophically ill.
Dave? Let me say this, too. Health care in this country is incredibly complicated, between government programs and people talking about just understanding their own explanation of benefits statement. You got to be a rocket scientist to figure that out. We have the opportunity to make some significant changes, and I don't think the changes are quite as sweeping as some might suggest they are. I think we are not talking about creating a single-payer system like they have in Canada. AARP would oppose that. We're not here to say somebody's got to stand in line and wait for a hip replacement or something like that. We're not talking about injecting some government bureaucrat between you and your doctor, any more so than insurance companies do today. they're between you and your doctor too, and the government is between you and your doctor too at times in healthcare decisions. There are these circumstances. We're not talking about a system of socialism. I know it's been called that by people. Socialism is where it really is a government-run program, where it's a single payer, they're running the whole show. That's not what's happening here. So I think if people, and the other thing to think about is, it's unbelievably complicated. There's a million cross-cutting interests in Washington battling for their piece of the pie. As Alan mentioned earlier, there's $2.4 trillion is spent on healthcare. It's 1/6 of our economy. It's going to grow to a much larger percentage of that if we don't do something. And one of the messages I think people need to hear is that even if they're struggling with it, even if they're concerned about it, and the anxiety is certainly palpable, and people clearly are worried about whether they're going to be able to keep what they have or how it's going to affect them. We have the opportunity to really make a difference here, to try to begin to get healthcare costs under control, to try to cover more people. I think it's been an interesting debate. I think it's been a debate that's gone on for a long time. Some people say, well, boy, we're really rushing this thing. I don't think so. We've been talking about this in Washington for 50 years. It's been an effort by multiple presidents, and I think it's time to step up and start taking some of the actions.
And actually, I know George has a question about how we pay for this, and so George's question is one that a lot of our guests had, which is maybe we need this, but how do we pay for it, George?
Right. I fundamentally don't think it's right. I love to be involved with my tax dollars to help people get what they need, but it's not a right, in my opinion. But if we're going to pay for it, if we're going to do it, how can we pay for it and still be responsible for what the government's responsibilities are to the nation?
I want to answer that, and I also want to say I agree with what was just said, that some of these things aren't happening, like moving towards more government involvement as a payer in the private sector. Some of the things that aren't happening because people like you have spoken up and said, no, this isn't what we want. Americans all over the country stood up and said, this is way too much. Much incremental reform has occurred over the last decade. I mean, you've seen Medicare Part D, you've seen expansion of health insurance programs for children through S-CHIP. So incremental reform has occurred along the way. I agree with you that the cost of this is what concerns me. Now, there are several bills that are in Washington right now. One bill, the bill that came out of the House that caused a lot of the outcry, led to incredible growth in the federal budget and led to significantly increased deficits. That caused the outcry. Now there's another bill in the Senate that doesn't have the deficits, but has significant increases in fees. For instance, billions of dollars in fees applied to insurance companies, billions of dollars in fees applied to medical device manufacturers. And don't think for a minute that doesn't get handed down. I mean, it does get handed down. As you heard earlier, there is no free lunch. There is a cost to this, and the cost is ultimately going to be borne by the American taxpayer. And I'm not arguing that there isn't cost intrinsic in the system today, because there are. It's accurate to say people that don't have coverage that go to the ER do generate cost. But people just need to understand, I think, there are unintended consequences when health policy is done. And my advocacy in Washington, when I've spent a lot of time up there, has been to make sure that we really understand the impact on small business, because they represent 75% of the employers in our state. And anything we do that potentially damages small business hurts job creation at one of the worst times in our history to do that. I would just argue that we need to be very careful about what the potential unintended consequences are, understand the financial impact to our budget, and recognize that whatever the solution is, it will take years before we see the ultimate result from it. It will not happen overnight.
How do we pay? And so it sounds like you're saying, Mr. Levine, we need to think more before we figure out how to pay, but are there any, can we pay?
I mean, people will say, is there enough money in the system? Is there not enough money in the system? I think there's enough money in the system. I want to go back to what Ms. Millie said earlier, that, and boy, I wish I could go back there. My dad was a physician and happened to be wearing his suit right now. And I grew up with the mindset that, son, medicine is an art. It's not ever to be treated as a business, and medicine and politics don't mix. Well, with all due respect to my dad, we're about 180 away from that. However, when that door closes, y'all all want pre-1968 medicine. And I'd much prefer you bring me a bushel of turnip greens than to swipe your Medicaid card or whatever at the door. But that's really what the patients want. And what happened in 1968 with the creation of Medicaid, Medicare, the government got into the conversation. Well, a group of economists got together at the Estes Park seminars in 1968 and started discussions to see what industry could we get our hands on over the next 10, 20, 30 years while someone's not minding the shop. Well, the someone not minding the shop were the doctors doing quality care with the patients in the old-fashioned way. Now, there were plenty of problems with that system, especially when it came to just bartering and you got to pay this for that, and so there needed to be some checks and balances. Then came Medicaid, Medicare. Well, I think the moneymakers and the business-minded folks said, wait a second, the government's getting into health care, we're not at the table, what can we create to be in the show? And they created insurance, private insurance. And so here we are. Everybody's got their hand out, and in that piece of pie, the pie hadn't changed much. If you look at, there's a graph, and it basically goes like this, where the public dollars, Medicaid and Medicare, going into the system universally around the country is going up, and the private insurance dollars are going down. So pretty soon, where they cross, that's sort of a single-payer system. That's the money that's in the system where they cross, you're fixed. So, we are kind of capitated if our federal government has a balanced budget.
So we're moving towards that, Don? Or
it's by default. If we do nothing, we will have change. Change will be imposed because the system's so heavy it's going to collapse on itself. Mm-hmm. So we have to do something. And I know everybody's concerned about, well, let's not go so fast to make some changes, but it doesn't matter because it's happening with or without government attempting through good policy to intervene and try to change the dynamic of the direction that we're heading in. More people or more employers dropped coverage last year than ever in the history of the United States. And they'll continue to drop coverage if they think there's an opportunity not to have to be responsible to be involved in health care and in paying for health care for their employees. So if there is an incentive whereby employers will stay in the system and work with the rest of the system until we can get this thing straightened up instead of dump everybody onto the uninsured rolls, that would be very drastic because there's a hidden tax every time someone goes off of insurance. Those of us who have insurance have to pay for it through a hidden tax. So that's what needs to be stopped.
I'd also say this. I know there's obviously an incredible distrust on the part of the American public for government today. It was very widely evident in August as people talked about it. Plus, you add to that healthcare is a very personal thing for individuals. And given some of the things that have occurred over the last couple of years, enormous intervention by the government in the economy, bailing out the banks, bailing out the car companies and everything, we're up to our necks in debt. It's not a pretty picture. The timing is not great. On the other hand, I would say this. I would say that, first of all, if you look at the costs of doing nothing over time, they really are quite compelling and quite disconcerting. There's that. Secondly, I think that members of Congress have enough sense at this point to realize that this is a real hot potato, and they need to deal with it very carefully, or they're all going to wind up getting thrown out. So, bottom line, I think there's a greater sense of accountability than you think. Obviously, we want them to do this right. And I think there are an awful lot of people at the table. There's been an enormous debate about these issues for quite some time. And I think the time to start taking those steps is now. And by the way, one thing I would say, yes, we have had incremental reforms over time. But notice one thing, they haven't actually gotten the costs down significantly. That's what has to be tackled here. And if there is a way to do it while actually insuring more people, which I know sounds completely counterintuitive, but the insurance companies are the ones that will tell you we can actually get to a better place if we have more people. The more people in the system, the better. So they're at the table supporting, as universal a coverage as we can get.
Dr. Polk, I know you had a question. We didn't get to you on the first half, but I know you had one for us for the second half.
I didn't have a question, but I was agreeing with Matt and the lady that said we need to come together. There's too much arguing and fussing and going on in one faction here, one faction there. We need to just come together because each person, I believe, deserves to be insured. And the United States is such a great country, and all Americans need to have some kind of insurance.
I agree with you, and you know, I function under the premise that we either better hang together or we're going to assuredly hang separately. If you look at Louisiana children, we know how far we have to go to get the good outcomes that every single one of them is capable of accomplishing. But the way you do that is you start with the mom being insured before she's pregnant. And you keep her on health insurance throughout her pregnancy. You don't kick her off of Medicaid after her 6-week visit. You keep her insured so that she is able to continue her health as well as the child's health. And you insure those two individuals. I'm not talking about the guys here today. Sorry, fellas. The mother and the child need to be insured through that child's 24th birthday. You do that and you wrap them in a medical, mental, dental health home, and a lot of these chronic diseases will disappear, specifically childhood obesity. And childhood obesity is killing America. And the reason I say that is because, one, it's a fact. If you look at a New England Journal of Medicine article in May of 2000.
I don't want to cut you off, but I want to make sure. Look, when you talked about wrapping them in a cocoon until 24, I thought I saw some raised eyebrows.
Dude, yeah. I'm not going to say that about my AARP colleagues because the grandparents have the same issue as their grandchildren. And it's the people in the middle that are messing up this discussion. And that's where the private insurance companies come in the middle.
Well, I got to say something about, private insurance companies are an easy target in this. I mean, I've dealt, by the way, I'm a health secretary, I'm a health professional, and I have struggled with EOBs and all the other stuff that I heard earlier. I agree. But, the private insurance companies, they do have a role in this system, and the role is, to a degree, they're trying to manage the cost in the system. At the same time, I heard somebody say earlier that it isn't that they're making these huge profits. Their profit margins are actually somewhat small. It's a lot of money. But the margins themselves aren't large. What they're trying to do is they're trying to manage downstream cost in the system. I've run hospitals for my whole career. To buy a new MRI costs millions of dollars. To buy a CAT scanner costs millions of dollars. When the newest drug comes out, I have to pay the full cost of that new drug for 7 years because they're protected. And so there are tremendous cost drivers in this system. And it's easy to blame the insurance companies. And effectively, the Medicaid program is an insurance company. I heard somebody before talk about denial of services. Medicaid denies services. Sure, government programs deny services too. So, I mean, I think it's easy politics when Washington demonizes an industry to be able to further a cause or to further a political endeavor. And it's easy to do that, and it's politics 101. But it isn't helpful when, in fact, I'll even quote an unlikely ally in this. I happen to I serve a Republican governor, as you know. But President Obama's own health care advisor, Dr. Zeke Emanuel, he himself, this is President Obama's advisor, he actually wrote a book published in last December, and he advocated getting rid of Medicaid altogether and giving everybody in Medicaid the ability to buy private health insurance. This is the president's own advisor. So there's bipartisan agreement on that. And in fact, it's exactly what we proposed here to reform our Medicaid program. So we agree with the president. And somewhere in the congressional process, there was this big overshoot about the public option and all this other stuff. Let's focus on what we agree on.
I know Tasha also had a question. We talked about hanging together or hanging separately in co-ops. And so your question dealt a little bit with, can we work together to manage healthcare for everyone better?
I hear a lot of discussion about the cost, and of course that's a concern of everyone, but also what about the quality? How can we manage the quality? Because it's documented that in the United States we spend more on health care than any other industrialized nation, and we are America, and of course we want to have longevity and sustainability and have our future generations to compete productively in the market, and we can't do that if we're all obese, we have hypertension and high cholesterol and what have you. So what can we do about the quality of health care?
I think you need to let the money follow the quality.
That's right.
Instead of the physician's office or nurse practitioner's office or whoever's office Just
See, we
volume,
all
volume,
agree
volume,
on
volume,
quality.
volume.
One of the
That's
things,
low-lying fruit.
one of the problems with the health marketplace, unlike a lot of other consumer marketplaces that you go to, is there isn't the level of information and transparency that people need to make educated choices about who is the best doctor for me to see on this, or is there real clear information about that. So there are a lot of provisions in the health care bills that we're talking about that try to move us much more in the direction of focusing on quality and outcomes and paying for performance as opposed to paying for volume of services.
I agree. I tell you that running the Medicaid program every year, the fight is if every provider group, the doctors, the hospitals, the nursing homes, the home and community-based providers, they all fight over a limited pot of money, and the fight is over who gets paid how much. It has nothing to do with who's providing the right service in the right place at the right time with the best outcomes. It's all about who's got the most political power, and that's how it gets done. And I'll tell you, to your point, Tasha, you're exactly right. If you look at the Medicare data, Louisiana spends more per capita than any other state in the United States, and we have the worst outcomes. We have the longest lengths of stay in the hospitals. We have one of the highest avoidable hospital admission rates in the country, and we spend more than anybody else. And so fundamentally, the system itself, it's almost, I kind of view it as an open checkbook, basically. The government, and not just the government, to be fair, some of the private payers too, effectively all they do is write checks without properly managing the services. One of the things that we are rolling out here in Louisiana is a disease management initiative for people with congestive heart failure, asthma, and diabetes, and eventually we'll do sickle cell and pulmonary disease as well. Where we looked at the top 10 people in Medicaid in Louisiana. We spent $25 million on them last year. And they were all people with chronic disease that bounced around in the system without any coordination of care, as Dr. Gordon was talking about.
Well, on the
looks like, well, maybe we'll only have time for one more question. I know Gary had one for us.
Well, you mentioned the cost of equipment, and I heard it in one of the town hall meetings that this LCD monitor, if you go to Walmart, it's $800, but if it's a medical LCD monitor, it's $4,000. Right. Now, it's like the $700 hammer. In other words, how do those types of costs get contained? In other words, because that's what the checks are being written for. And you said the $1 million MRI. Well, if it's sitting right here and
if that cost is factored in the Medicare some kind of way per capita, because in that doctor's office and the Medicare is paying this, and the Medicare per capita in Louisiana is the highest in the country. But I need to point this out. By the time you're eligible for Medicare, you're 65, 66, 67. In this state, you've inherited a very sick population of people.
Correct.
A quarter of the state's population is in the public system. I happen to work in that system. I think it's one of the best systems we have. It has its flaws, but we do the most quality, we have the most cost-effective, and we do it cheaper than any of the private hospitals do it. Now, with that said, the Medicaid population that's in that is mostly pregnant women and children, and the nursing homes. Well, the nursing homes are double dipping. I'm sorry. They got the Medicare dollars flowing in, they got the Medicaid dollars flowing in. Pediatrics and maternal health don't get Medicare. So I would support Dr. what's his name? Zeke Emanuel. I'd support doing away with Medicaid, but give us the Medicare benefit package for our children, and then everybody's happy, and then you get Medicaid out of state government, and then there's one federal program, the medical program that's Medicaid, Medicare, that doesn't allow states to screw it up for its own citizens.
But how do we keep those costs down? How do we not pay $4,000 for an $800 monitor?
Quality.
I can't even say enough about that's a whole different television show about the cost of technology, the cost of new drugs, and what they're doing to the system on the downstream side, while the providers are stuck in the middle. And I say providers meaning the doctors and the hospitals that are stuck in the middle with these fixed payment systems. And I'll tell you one last thing. You look at a primary care pediatrician. This guy works as hard as anybody out there. But if you look at the shortages that we have of physicians going forward, I was in a room full of students not a month ago, and I asked them, how many of you plan to be a lawyer when you grow up? And a bunch of hands went up. How many of you want to be a doctor? Very few hands went up. That frightens me, and it should frighten all of us as we see our population age. But I'll tell you something. When a doctor comes out of residency and makes, and I know this sounds like a lot of money, but to a doctor who comes out with $200,000 of debt, and has to pay $200,000 for medical liability insurance on January 1st just so he can practice or she can practice, when that doctor is going to make $150,000 a year to be a primary care doctor, they're going to become a specialist where they can make a lot more money by doing more procedures. And this perpetuates this problem in our system. We fundamentally have to do some payment reform that I think changes the incentives towards quality and outcomes and less towards, kind of the government deciding which providers are more important than others. And make no mistake, what Medicare decides how they're going to pay, the private payers follow. And that's precisely what's happening.
Well, the hourglass is telling us that we've got to go tonight. And so we've got some hard deadlines. We want to thank our panelists, Mr. Levine, Ms. Fraiche, Mr. Sloane, and Dr. Gordon. When we come back, we'll have a few closing comments.
Well, a very civil conversation. No one throwing anything.
No
I don't think any
throwing,
guns
no
here.
epithets.
But we understand it is such a complicated topic. It just begins the conversation.
Exactly. We still didn't get a chance to talk about tort reform or drugs, and so there's more to talk about. But I think a great discussion with some great questions and some great comments.
And we'll be following up on that, and we hope everyone will join us online as well. Exactly. Well, that's all the time we have for this edition of Louisiana Public Square. We invite you to visit our website at lpb.org/public square to find more information about current health care reform proposals. While you're there, take this month's survey, sign up to follow us on Twitter, or comment on the show. Kathleen wrote us after being in the Mississippi studio audience of our August program on lessons learned since Hurricanes Rita and Katrina. Kathleen writes, I want to thank you for the opportunity to be at the live simultaneous taping of this discussion on Katrina. There needs to be much more discussion on what has worked and even more honestly on what has not worked. Case management needs to be standardized and the pilot programs need to be expanded upon so that all those who have not recovered are covered by these critical services. Well, thanks, Kathleen, for participating and commenting. After her appearance, we understand Kathleen was able to get a meeting with one of the Mississippi panelists to further discuss her concerns.
We'd like to invite viewers to watch the 90-minute PBS special report on healthcare reform that will air Thursday, September the 24th at 8 p.m. We also ask you to join us in October as Louisiana Public Square looks at what factors contribute to our state's high incidence of crime and how we can combat that challenging problem of crime in Louisiana. Thanks for watching, and good night.
Good night, everyone.
For a copy of this program, call 1-800-973-7246 or go online to www.lpb.org. Support for this program is provided by the men and women of the Louisiana Forestry Association. Through sustainable forestry, LFA members promote the health and productivity of Louisiana's forests for generations to come. And the Foundation for Excellence in Louisiana Public Broadcasting. Support provided in part by Louisiana Health Care Review, helping healthcare providers lower costs and improve quality for over 20 years. Information about healthcare improvement in Louisiana is available at www.lhcr.org.